Tranexamic acid is a life-saving antifibrinolytic agent. But what happens if it accidentally injected into the subarachnoid space during spinal anesthesia? This rare but devastating mistake has led to seizures, cardiac arrest, and tragically even death. Let's explore why this happens, what exactly goes wrong inside the nervous system, and the immediate steps required to manage this critical emergency. Accidental intrathecal injection of tranexamic acid or TXA instead of a local anesthetic during a subarachnoid block is one of the most catastrophic medication errors in anesthesia practice. The cause is often a look-alike, sound-alike error. Ampoules of tranexamic acid and local anesthetics like bupivacaine can have very similar appearances, especially in a fast-paced operating room environment. A momentary lapse in concentration, poor lighting, or failure to strict double-checking protocols can lead to this disastrous mix-up. Within seconds of the injection, the patient experiences an excruciating burning sensation in their back and lower limb, often described as feeling like a fire. This is immediately followed by uncontrollable muscle jerks known as myoclonus, which rapidly progress to violent, generalized tonic-clonic seizures. These seizures can be so severe that they become refractory, meaning they don't respond to initial treatment, a condition called status epilepticus. Simultaneously, the cardiovascular system goes into overdrive. The massive neurotoxic effect triggers a huge sympathetic nervous system discharge, causing a sudden, dramatic spike in heart rate and blood pressure. This extreme hypertension and tachycardia can lead to dangerous cardiac arrhythmias such as ventricular fibrillation and ultimately cardiac arrest. Now let's quickly summarize the devastating consequences of this error. First, there is the immediate severe back and leg pain, which is the initial red flag. This is followed by myoclonus and generalized seizure that often difficult to control. In patients who survive the initial event, paraplegia or other permanent neurological damage is a significant risk. The cardiovascular effects are just as severe, including extreme hypertension, tachycardia, and life-threatening ventricular fibrillation. Most alarmingly, published case reports indicate a mortality rate of nearly 50% following accidental intrathecal tranexamic injection, highlighting the extreme gravity of this medical error. So, how does tranexamic acid causes such intense and widespread neurotoxicity? The answer lies in its effect on the brain's primary inhibitory neurotransmitters, particularly GABA and glycine. Under normal circumstances, GABA and glycine receptors act like brakes on the nervous system, preventing neurons from firing uncontrollably and maintaining a stable electrical balance. Tranexamic acid, however, acts as a competitive antagonist at the GABA A and glycine receptors. This means it binds to the same sites that GABA and glycine would, effectively blocking them from doing their job. When these crucial inhibitory pathways are blocked, the brakes are removed. Neurons become hyper-excitable, firing chaotically and leading to the uncontrolled electrical storm that manifests as seizures. This massive overstimulation of the nervous system also triggers that huge sympathetic discharge we talked about, causing the surge in blood pressure and heart rate that can lead to cardiac collapse. It's a direct, potent poisoning of the central nervous system's fundamental control mechanism. Given the rapid and severe onset of symptoms, immediate and aggressive management is absolutely crucial for any chance of survival. The first priority is to follow the classic ABC approach of resuscitation. First, airway and breathing. The patient must be immediately intubated to secure the airway, and general anesthesia should be induced. This not only helps control the refractory seizures but also prevents hypoxia, which would cause further brain damage. Mechanical ventilation is essential. Next is circulation. Establish multiple large bore IV lines to administer medications quickly. The severe hypertension must be controlled urgently using potent beta blockers like labetalol or esmolol. Any cardiac arrhythmias must be treated according to Advanced Cardiac Life Support ACLS protocols. Medications like amiodarone might be necessary to stabilize the heart's rhythm. Finally, we need to address the seizures directly. First-line treatment involves intravenous benzodiazepine such as midazolam or diazepam. If the seizure persists, despite this, which they often do, you must escalate treatment to a continuous infusion of an anesthetic agent like propofol or an older barbiturate like thiopental. The anticonvulsant levetiracetam may also be used as a part of management strategy. Alongside these supportive measures, there is one potentially life-saving intervention that must be considered immediately. That is cerebrospinal fluid lavage. The goal of this procedure is to physically wash the toxic drug out of the subarachnoid space. It's a race against time to dilute and remove the tranexamic acid before it causes irreversible damage. The procedure involves performing a lumbar puncture to access the CSF. A small amount of CSF, typically 5 to 10 milliliters at a time, are carefully aspirated. This fluid containing the tranexamic acid is then replaced with an equal volume of preservative-free normal saline. This process of aspiration and replacement is repeated multiple times, washing the spinal space. The total volume exchanged is usually between 100 to 200 milliliters or sometimes even more. Case reports have shown that early and aggressive CSF lavage can significantly improve outcomes and may be the deciding factor between survival with recovery and permanent neurological injury or death. After the initial stabilization in the operating room, the patient's journey is far from over. They must be transferred to the ICU for continuous round-the-clock monitoring and supportive care. The neurotoxic effect of tranexamic acid can persist for days. The patient will likely require continued mechanical ventilation and sedation to control seizures and protect the brain. Continuous EEG monitoring is vital to detect any ongoing seizure activity. even if the patient is paralyzed by muscle relaxants. Cardiovascular stability remains a major concern, requiring constant monitoring of blood pressure and heart rhythm. Furthermore, the intense muscle contractions from the seizures can cause rhabdomyolysis, a condition where muscle breaks down and releases harmful proteins into the blood, potentially leading to kidney failure. Therefore, kidney function must be also closely monitored. Recovery, if it occurs, it often slows and requires extensive rehabilitation. Accidental intrathecal injection of tranexamic acid is a tragic but preventable error. It serves as a stark reminder for all the healthcare professionals, especially those in the anesthesia and surgery, of the critical importance of vigilance. Always read the label, always double check every ampoule and syringe before injection. In anesthesia, one small momentary mistake can truly have fatal consequences. If you found this deep dive into a critical medical event informative, please consider giving this video a like and sharing it with others who might benefit from this knowledge. Don't forget to subscribe to our channel for more real medical insights and case discussions. Thank you so much for watching.